Welcome back to The Big Picture on this Tuesday. If you spent much time outside, of course, it is warming up. Those ticks are looking to hitch a ride on you. So right now, we are joined by Dr. Vanessa Verrill, Chief Research Officer with The Ohio State University's Infectious Disease Institute. Thank you so much for coming in.
Okay, so I already revealed what my first question would be. Because in the news, when we run these stories about mosquitoes or ticks and we see them crawling, or bed bugs, that's another one. It just gives me the creepy crawlies. Do you find that in your research? Do you go home and you're just like, oh, today,
Yes, and I talk about ticks a lot, so my husband and daughter know all about it.
And we had heard some insight that this tick season was going to be especially bad this year. Is that what you are seeing from your research?
Yeah, so what we're seeing, especially through our Buckeye Tick Test laboratory, the data are showing that there's a really clear picture of where ticks are spreading and what pathogens or germs that they're carrying. And statewide, what we're seeing is that the black-legged tick, also known as deer tick, about 1 in 5 of these black-legged tick adults are carrying the pathogen for Lyme disease.
Oh, and it's Lyme Disease Awareness Month, which I had not realized.
As someone who, one of my chemistry teacher in high school had, he was someone who was affected by Lyme disease. And this can be an incredibly debilitating disease, depending on the severity of it. So, I guess when it comes to identifying ticks and using them and identifying pathogens and whatnot, how does this work?
Right. So the Buckeye Tick Test is part of Ohio State's Infectious Diseases Institute. And we work closely with Dr. Risa Pesapane and her lab in the College of Veterinary Medicine. And we work to understand how ticks are spreading, which ticks are present, and how they're spreading across Ohio. So together we launched the Buckeye Tick Test last year, and the lab really serves 2 roles. So first, it's a public-facing fee-for-service where people can send in their ticks that they found on themselves or their pets or other animals. Yeah. And we identify the species and test for pathogens. So again, those are germs like bacteria that can cause disease and make us sick. And I can attest that this has been a valuable resource for my own family and friends.
What do we get out of this as a community for participating in the Buckeye Tick Test? What's the benefit to the community?
So it really helps both the individual and at the community level. So for individuals, it can give you a better sense of risk. So what tick is present, what the species is, and then also what pathogens that they're carrying. And this can be really useful information to be able to have conversations with your healthcare provider or veterinarian, but it is important to note that tick testing shouldn't replace medical evaluation or delay care, especially if somebody is experiencing symptoms. But I will say that some people even submit ticks that they find in their yard, even if they weren't bitten, so that they can get a better sense of potential exposure for their family or pets from their property. And from the community level, I will say that every tick that's submitted to Buckeye Tick Test contributes to statewide surveillance. So this helps us better track which tick species are present, what pathogens they're carrying, where they're being found, and when they're active. So we share this with public health and research partners, and this ultimately contributes to better surveillance and prevention strategies and public health preparedness.
Well, we had a really harsh winter. We had weeks there where we were down in the single digits. And what does that mean for the tick season to come? I mean, they're out now. We need to start being aware, because I feel like tick season in my mind is kind of later in the summer, but they're already here.
Yes, and ticks are not just an issue in the spring or summer. Many tick species, including the black-legged ticks or the deer ticks, which carry the causative agent for Lyme disease, they're active year round.
Oh,
So
no.
even in the winter, especially during milder winter days. And another thing that we're seeing is that more than half of the ticks that people report are not coming from parks or hiking trails. They're being found right at home in their own backyards and neighborhoods.
Okay. Wow. So I'm thinking to myself, we're going to go for a family hike. I'm going to be prepared. We're going to wear our long layers but I'm not thinking about it every day when I walk out into my yard. Oh man.
They're out there.
Yeah. There are effective ways to prevent your chances of getting tick bites. And these include, yes, wearing long pants and tucking into your socks wherein possible, using EPA registered repellents on any exposed skin. And you can also consider using permethrin treated clothing, which helps repel and kill ticks as an added layer of protection. But it's really important to do a careful tick check after you've been outside, and also to shower if you can when returning indoors.
How do you talk to your child about this? Because you mentioned your daughter. I have a 7.5-year-old at home. How do I make sure he understands that when he heads out to play, that we've got to be aware of ticks?
Yes. So I just tell my daughter that, ticks are these, creatures that can cause germs and disease. So yes, we want to enjoy the outdoors, but also we need to stay safe. And so, we've got to put on these repellents or wear long pants. And then when we come indoors, let's just check and make sure that we don't have any on us, and make sure that, when we're bathing, that we're doing tick checks. So, yeah.
It's good advice. I mean, here we are, and just talking about it. I didn't even see any video, and it gives me the heebie-jeebies. Oh my goodness.
All right. Dr. Beryl J., thanks so much for coming in here on The Big Picture and joining us.